Heart rate. So what is the normal heart rate? The normal heart rate is 72. It's 72 per minute. What is the range? It ranges from 60 to 80 per minute. What is tachycardia? Tachycardia means increase in the heart rate, that is above 100 per minute. What are the conditions when the tachycardia occurs? In the children, exercise, during pregnancy, or emotional conditions such as anxiety. The pathological condition when tachycardia occurs are fever, anemia, hypoxia, hyperthyroidism, hypersecretion of catecholamines, etc. What is bradycardia? Bradycardia means decrease in the heart rate, that is, the heart rate is below 60 per minute. The condition when the bradycardia occurs is during the sleep or the athletes. Pathological condition when the bradycardia occurs is hypothermia, hypothyroidism, heart attack, heart failure, obstructive jaundice. What are the drugs that induce bradycardia? Beta blockers, channel blockers, digitalis. The heart rate, it is regulated by nervous mechanism that consists of three components: vasomotor center, motor nerve fibers to the heart, and the sensory nerve fibers from the heart. So vasomotor center, it is the nervous center that regulates the heart rate. It is the same center in the brain that regulates the blood pressure. So it is known as cardiac center. The vasomotor center, it is bilaterally situated in reticular formation of the medulla oblongata and the lower part of the pons. So the vasoconstrictor area, it is situated at the reticular formation of medulla in the floor of the fourth ventricle, and it forms the lateral portion of the vasomotor center. What is the function of vasoconstrictor area? It increases the heart rate by sending to the heart through the sympathetic nerves. The vasodilator area, it is seen in the reticular formation of medulla in the floor of the fourth ventricle and forms the medial portion of the vasomotor center. It decreases the heart rate by sending inhibitory impulse to heart through the vagus nerve. And the sensory area, it is the posterior part of the vasomotor center that lies in the nucleus solitarius, the nucleus of the tractus solitarius, and it controls the vasoconstrictor and vasodilator area. Now, what is the motor nerve fiber to the heart? The heart receives the afferent nerve from both the division of autonomous nervous system, that is the sympathetic and parasympathetic nerves. The parasympathetic nerve fibers, they arise from the medulla oblongata, they passes through the vagus nerve, whereas the sympathetic nerve fibers, they arise from the T1 to T4 segment of the spinal cord. The parasympathetic nerve fibers, they arise from the dorsal nucleus of the vagus. The nucleus is situated in the fourth ventricle in the medulla oblongata. The vagus nerve fibers, they are inhibitory in function and they carry inhibitory impulse. From which region? From the vasodilator area to the heart. So stimulation of the vagus nerve stops the heartbeat due to the inhibition of the SA node. So because of this, when the stoppage of heartbeat, it is continuous for some time, part of the ventricular musculature become a pacemaker and it starts producing impulses. Heart block, the stimulation of left vagus, inhibition of AV node. So because of this, some of the impulses from SA node are not conducted to the ventricles. This is partial heart block. Stimulation with the strong stimulus will cause stoppage of the ventricular contraction and that can cause complete heart block. The sympathetic nerve fibers, they origin from the T1 to T4 segment of the spinal cord. The sympathetic nerves are cardioaccelerator in function and they carry accelerator impulses from the constrictor vasoconstrictor area of the to the heart. The sensory nerve fibers from heart, the afferent nerves from the heart passes through the inferior cervical sympathetic nerve. So they carry sensation of stretch and pain from heart to brain by the spinal cord. What are the factors that affect the vasomotor center? Impulses from the higher center, impulses from the respiratory centers, impulses from the baroreceptors, reflex, impulses from the chemoreceptor, and impulses from right atrium brain bridge reflex. What are the impulses from the higher center? That could be either due to the cerebral cortex or hypothalamus. So during emotional condition, this area sends inhibitory impulses to the vasodilator area. This causes reduction in the vagal tone, leading to cardioacceleration. The hypothalamus influences heart rate by vasomotor nuclei, by the vasomotor center. Stimulation of posterior and lateral hypothalamus nuclei that can cause tachycardia. Second, the impulses from the respiratory center. In the forced breathing, the heart rate increases during inspiration and it decreases during the expiration. And this variation is known as respiratory sinus arrhythmia. Sinus arrhythmia, it is due to the alteration of the vagal tone because of impulses arising from the respiratory center during the inspiration. So these impulses will inhibit the vasodilator area, resulting in increase of the heart rate. During expiration, the respiratory center stops sending impulses to vasodilator center. If the vagal tone increases, then will be decrease in the heart rate. Impulses from the baroreceptor, that is the Maris reflex. It is a cardio inhibitory reflex that decreases the heart rate when blood pressure increases. So when the blood pressure increases, the aortic and carotid baroreceptors, they are stimulated. The stimulatory receptors, they are sent to the nucleus of tractus solitarius. The nucleus of tractus solitarius, it stimulates the vasodilator area. That in turn increases the vagal tone, leading to decrease in the heart rate. What is Mary's law? According to Mary's law, the pulse rate, it is inversely proportional to the blood pressure. Fourth is the impulses from the chemoreceptors. The chemoreceptors give response to change in the chemical constituent of blood, particularly the oxygen, carbon dioxide, and hydrogen ion concentration. These peripheral chemoreceptors, they are situated in the carotid body and aortic body adjacent to the baroreceptor structures. The chemoreceptors in the carotid body, they are supplied by herring nerve, and the chemoreceptors in the aortic body, they are supplied by aortic nerve. When there is hypoxia, hypercapnia, and increased hydrogen ion concentration in the blood, the chemoreceptors, they are stimulated. So the inhibitory impulses, they are sent to vasodilator area, vagal tone decreases and heart rate increases. So the nerves supplying these receptors, they are known as buffer nerves. Another is brain bridge reflex. It is also known as cardio accelerator reflex. It is a cardio accelerator reflex that increases heart rate when the venous return is increased. Since this reflex arises from the right atrium, it is also known as right atrial reflex.